Hey, all my pink supporters and fellow pink warriors. This is Tammy Frazier, and I'm kind of back where I started, at the kind of back in the same scenery, but a lot has changed. But I am at the 6-week post-op mark of a double mastectomy with immediate reconstruction, and just wanted to do an update. So I've had some ups and downs since my last video, and I've been able to meet with the oncologist and the radiologist to talk about treatment. And if you remember from my first video, and probably at least one other subsequent video, I mentioned my spidey cancer senses. And I said that I did not think that chemo was going to be needed, but I felt like radiation was going to be recommended. So the oncotype test results came back, and met with the oncologist. And for the oncotype test, if a score of 25, higher than 25 comes back, then chemo is recommended. There are certainly other factors that are in there as well, but all of my factors gave me a oncotype score of 13. So no chemo was recommended. However, my oncologist did, being the thorough doctor that he did get a second opinion from an oncologist at MD Anderson in Texas. It's like the best cancer center in the nation, because I have a complicated case. And I'll remind you of that complicated case because I had mentioned it in a previous video. I have no cancer was detected in the left breast. And yet, each of the sentinel lymph nodes that were taken from either side, both of those had tumor cells in them. So it's very, very, very rare for there to be tumor cells on a side where breast cancer was not detected. And the tissue was biopsied from the left side as well. So that's just a rare thing. So he did make sure that he got a second opinion from another oncologist before, coming and telling me no chemo. So kudos to him. Excited about that. Now, fast forward, I don't know, five days after that, I meet with the radiologist to go over everything, and she is recommending radiation because my case is complicated, not because the margins were, there were any issues with the margins after surgery. All my margins are clear, no cancer, all the cancer has been removed, but because there's not enough data about this rare thing that is going on with the sentinel lymph nodes, she is recommending it because she doesn't feel comfortable not recommending it. Not because she knows I need it, not because she knows for sure that I will have a reoccurrence. She just doesn't know. So it's let's radiate just in case. So she did not do her due diligence and get a second opinion ahead of time, but she is now going to do that. So we scheduled an appointment for 2 weeks to give her some time to do that, and which is fine because if I were to decide to get radiation, it wouldn't start until I'm finished my fills of my expanders anyway, and I've got 1 or 2 more fills to do, and that happens every other week, so there's time. She reminded me that because the data isn't there, the few studies that they have done, of course, because it's so rare, it's not a large pool of people that they can study. And then on top of that, they only followed them for 4 years. So they don't even have the statistics on survivability beyond the 4 years and reoccurrence beyond the 4 years. So that's mainly, that's mainly what makes her recommend, is just because we don't know. So let's just play it safe and do it. I am not thrilled about the common, even. I'm not even talking about the uncommon, which could happen. But I'm not thrilled about the common side effects of radiation when we don't know for sure that I need it. Because in addition to, all the common things with reconstruction, it could complicate reconstruction. It's certainly going to delay reconstruction, because after radiation is finished, and she's talking about if it's a long course of radiation, then it would be 24 doses. So that's once a week, every weekday, not including holidays, for 24 doses. And then after that, reconstruction couldn't take place for 6 months if there are no complications from the radiation. So results of reconstruction cannot be as good or fail because of radiation. So I've had a family member that has had that happen, had multiple surgeries, and then just got so tired of having surgeries that she was like, you know what, I'm just going to go flat. So it's a lot of decisions to make without scientific data to base the decisions on. So we'll kind of see what happens there. But I go back to work tomorrow. So all of this peace and serenity and spending time with the deer in the morning comes to an end, and it changes to organized chaos of middle school PE classes. So continue to pray for me, not just for my cancer journey, but also for going back to work with the middle school kids, please, because that's going to be a shock of going from this peace and serenity back into that. But and also thank you, and continue to keep the votes coming in for Fab Over 40. I appreciate it. And I'll keep you guys updated with what I find out on the second opinion, and with what decisions I make. So thanks for watching. Have a good one.